So we're going to be talking about the dying process. A lot of patients that you're going to be seeing where death is imminent are patients with heart failure, stroke, diabetes, cancer, pneumonia, Alzheimer's. So first of all, death is the cessation of bodily fluids going to major organs. So we're talking about your brain, heart isn't getting the blood that it needs, lungs, kidneys. So you're going to start seeing a lot of the signs and symptoms. Confusion and sleeping. They're not going to be very responsive. Sometimes they're not going to be orientated. So as a nurse, you're just going to have to talk to them like you would, explain everything clearly and just talk to them, even though they might not respond. They can still be listening. So when the kidneys are failing, you're going to check the INOs. Urine output's going to be low. BUN, creatinine, renal tests. Respiratory is going to be, so respirations are going to be low. There's going to be some congestion in the chest. It's going to sound like crackles. And then also breathing is going to be really different. Sometimes it's going to be rapid, sometimes it's going to be shallow. It's going to change a lot. Another thing that's going to change is their appetite. Sometimes they're not going to eat at all, and you can't get them to eat anything, and then sometimes they might surprise you and they'll eat a big meal. But if they can't eat, don't force it on them. Sometimes they might just want ice chips. That'll be all they can do. So just adjust to day by day. Vitals are going to be out of whack, major hypotension. Blood pressure is going to go very low as they get closer to death. Modeling of the skin is going to start at the feet, so that when you do your assessment daily or even every few hours, you're going to be checking the feet, and as they're getting closer to death, it's going to work its way up the body. And then whenever hallucinations start, that's when death is very close, and you might have to call a family member. They're going to be seeing young children, animals, family members that have passed away.
The nurse is there to provide comfort to the patient and their family. The nurse will let the family and the patient know about different options that they have as far as maybe hospice. Hospice provides emotional, spiritual, and physical needs for the family and the patient. They offer 24-hour care, and they can also teach the patient about their disease process and what to expect, the symptoms, and what to expect with it. The patient and the family will need to make plans such as financial needs or a living will or having a power of attorney. The living will is a document that specifies the care of the patient, what the patient wants and what the patient doesn't want. The power of attorney is a person that oversees the patient's decisions in a case that they are unable to. The person is usually a spouse or a family member, but they also can have an appointed power of attorney. The nurse also addresses the patient's pain. That is the number one thing to address with the dying patient is their pain.